Good morning, everybody, and thank you for joining us. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take just a moment to click buttons to make sure that all of the media joining us have permission to record. You will have permission to record this briefing, and we are also recording, and that video will be available on the Health District's website and YouTube channel later today. So give me just a moment. Okay, everybody should have permission to record now, but if you run into any issues, please send a message to the Joint Information Center through the chat. Otherwise, we'll go ahead and move forward. Everyone, we're joined this morning with Snohomish County Executive Dave Summers and Snohomish Health District Administrative Officer Shawn Frederick. Each of our speakers will provide an update, and after they've shared their comments, we'll take questions using the chat feature. Please make sure that your questions are submitted to everyone so that all the speakers can see. Thank you again for joining us. And with that, I'll turn it over to Executive Summers.
Thank you, Heather. Good morning, everybody. Thanks for being here. So last few weeks have shown us some real progress. Our case rates have been slowly declining, but as we'll hear from Shawn Frederick in a few minutes, the progress is rather fragile and we must keep up our efforts and remain vigilant. So progress, but caution. We did recently pass a major milestone in Snohomish County. 70% of eligible people in the county ages 12 plus are now fully vaccinated against COVID-19. That's 70% ages 12 plus. That's great news. It's also time to remind everybody, though, that each of us really plays the most important role in the fight against COVID. We need to get our shots, vaccines, wash our hands, wear a mask. All the protective measures we've been talking about for the last year and a half still remain in effect and very important, but it all comes down to individual action. A few weeks ago, I shared our American Rescue Plan Act recovery plan that was approved by the Snohomish County Council. The federal funds will be used for the county's ongoing response and recovery work related to the pandemic. So under the leadership of Chief Recovery Officer Mike Fong, our new Office of Recovery has been convening discussions with mayors, community leaders, and partners in the private and nonprofit sectors. In the coming weeks, we're going to be announcing concrete proposals to provide shelter and behavioral health supports to folks in our community in conjunction with our city partners, since many of the people affected in the county are within cities and are some of the most hardest hit individuals in our community. So working hand in hand with our cities to combine our efforts. We've also clearly heard that we can do more to support those looking for work by providing access to training as well as affordable childcare, which remains a big problem for many people. So just providing that care so they can get back to work. So we'll be focusing some efforts and dollars on those. We're also continuing to work to establish the Carnegie Employment Support Services Center in the old Carnegie Library. Community partners will provide one-stop services at the Carnegie Center. Center is really going to ensure a family-friendly approach for low-income households who have suffered negative economic impacts from the COVID-19 pandemic. Open to everybody, but one-stop shop for assistance. Households will receive assistance in labor force entry or re-entry opportunities, with the goal really of increased economic and housing stability for those families and our residents. It's really a critical economic development tool to get people back to work. And another focal point for us is going to be providing access to broadband communities throughout the county and to communities that have been left out with broadband access. We've seen the importance of broadband during the pandemic. So I'm really grateful to the County Council for partnering with us to dedicate recovery dollars to build our broadband system out, particularly in rural areas. So again, that will be another focus of ours in the coming weeks and months. All these investments will help those in need to ensure we're doing all we can to help our community recover from the pandemic. So with that, I'll hand it off to Administrative Officer for the Snohomish Health District, Shawn Frederick. Shawn.
Thank you, Executive Summers, and good morning, everyone. As Executive Summers mentioned, unfortunately, after 7 weeks of decreasing cases, we saw our case rate increase again. For the 2-week period ending this past Saturday, October 23rd, the case rate rose from 331 to 351 cases per 100,000 over that rolling 2-week period. We had more than 1,600 new cases reported to us last week alone. So if that trend continues again this week, we'll pretty quickly see our case rates exceeding 400 again. The hospital situation remains relatively unchanged, with anywhere from 60 to 70 people in Snohomish County hospitals with COVID-19, with 15 to 20 of them requiring ventilators. Last Friday, we had 24 people requiring mechanical ventilation to breathe. And sadly, we lost at least 20 residents to COVID so far this month. As Dr. Spitters has shared many times, Snohomish County remains in what the CDC defines as high transmission levels. COVID is still circulating, and unfortunately, it's impacting our businesses, communities, and schools. We did take a look at data from the last 2 weeks, and the numbers point to what we've been hearing anecdotally. Our school-age residents make up a large number of new cases. From October 10th to the 23rd, about 1 in 5 cases was a patient that was 14 or younger. That age range was the largest proportion of cases at 22%, or 662 of nearly 3,000 cases during that same time period. Another 57% of those cases were 20 to 49. So since the case investigations are underway for most cases, it's too early to say where the infections were acquired and if they were vaccinated or not. I would say look for more detailed monthly reports to be released later this week. What we need now is for everybody to mask up and vax up. You know, both your flu shots for everyone 6 months and older, and the COVID vaccine for everyone that is eligible. Our Ashway Park and Ride continues to offer vaccines on Wednesdays and Thursdays, and testing on Fridays, Saturdays, and Sundays from 9 a.m. to 4 p.m. We're closely monitoring volumes to determine if and when we'll need additional sites to be opened. Thankfully, we have many more partners in Snohomish County offering vaccines than we did 6 to 8 months ago. All of the available doses are readily available throughout the county through all of our partners in existing sites. Whether it's your healthcare provider's office, your local pharmacy, or a local community clinic, take 10 minutes today to get your vaccine. You know, with that, I'll turn it back to Executive Summers.
Thank you, Shawn. Our first question is, tell us more about the Madrona School COVID outbreak in Edmonds. How did it happen, and what does contact tracing show? And how can this one school be hit so hard? I don't have any information on that. Shawn?
Sure. You know, we're not able to share specifics on cases because of HIPAA. But what happened at Madrona is really not unique. As I shared earlier, school-age students make up the largest segment of cases in the last 2 weeks. What we're seeing countywide is students and staff being infected outside of the classroom and then going to schools, children and youth sports. So our schools have some of the best mitigation measures in place, and we need people to continue to step outside of the class.
What is the county doing to prepare for vaccines to be approved for younger kids? And is the county considering any sort of requirement for those vaccines? Maybe Shawn could talk about our preparations for.
Sure. We are, obviously, we're monitoring the situation with all of the discussions around the CDC and vaccine approvals, particularly those for 5 through 11-year-olds. And, you know, we're planning our contingencies. Ideally, we would have 5 through 11-year-olds work with their healthcare providers, their existing healthcare providers or local pharmacies. We've had conversations with schools about how we could have coordinated efforts to support getting youth vaccinated through those means. And really, that's to make sure that we do a lot of the work that needs to be done, getting our young ones caught up on all those things that have been put on hold during COVID, things like child checks and other immunizations that need to be caught up so that we make sure that we keep our children broadly safe from the full body of diseases that are out there, not just COVID.
Are you aware of any school districts or anybody talking about mandates for vaccines?
I'm not aware of any.
Any plans for more strict vaccine requirements? Bars, restaurants, gyms, maybe something similar to King County. The county, of course, are waiting for the federal requirements to come down for organizations of 100 employees or larger. We know those are coming, and there's some drafts circulating at the federal level that we have not seen. But that's been our focus, is what the requirements will be for county employees, but we're not discussing, at least have not recently, any increased restrictions for bars, restaurants, or gyms. Shawn, any news on that front?
No, there have been no conversations around any additional requirements in any of those regards.
Questions? Okay, again, back to Madrona School. And why was it hit? Seemed to be hit harder compared to other schools.
Again, as I mentioned earlier, it's too soon to tell, so I would keep an eye out for future reports.
Has the county heard any info on availability of kid-approved vaccines, since they will be different dosages? Do we have any inside information on that?
No, there's very rarely any inside information given out on those approvals. We very much find out in real time with everyone else.
I think we do know that with the approval, the manufacturers know that they have to provide doses in a different manner than they did for the adult version. So that is all the information we have on it, but we're sure that they will be arriving. It's the same vaccine, just a different dose. So it's a manufacturing process issue, as I understand it, but I have no inside information on that.
Yeah, I will share, and it's really a reminder. It's certainly out there in the public already, but the FDA is meeting today, and the CDC is meeting November 2nd and 3rd.
Further questions? I said hospitals remain the same. How is capacity at hospitals?
Right now, hospital capacity, we're still seeing an occupancy around 90% plus or minus. So it's still really important. We've seen pretty consistent, as I mentioned earlier in the comments, we have about 60 or so patients at any given time with COVID in the hospitals, but we still have other patients in the hospitals as well. So it's really important that we're all doing our part to make sure that we preserve our hospital capacity. So again, mask up, vax up, maintaining your distance and doing all of those things are incredibly important to make sure that when we need the hospital capacity for all of those things not related to COVID, that it's still there.
Any concerns about hospital capacity if an anticipated winter COVID surge shows up? And I think the answer to that is yes. As Shawn mentioned, they are running pretty full, and we've seen, in the past when we do get surges that they're really stressed to the max. And there's a lot of elective types of procedures, and this is anecdotal information, but my understanding, a lot of procedures and care that was delayed or deferred because of capacity concerns for non-COVID issues is what is really driving a lot of the population now in our hospitals. And so any surge in COVID is going to just stress that system. So we are concerned about that. But again, vaccines, masks, washing hands, we just need to keep those numbers come down. Are there any elective procedures continuing to be canceled? Are you aware of anything, Shawn?
I would actually defer to the Washington Hospital Association on that. They're really monitoring that along with DOH at a global level, much more closely. They'll have much more accurate information in that regard.
Yeah. So question for me, you call it fragile progress, yet Shawn, sounds like we're not making progress and case numbers going up again. So the general trend over the last number of weeks has been downward. We did see a small increase this week of about 20 cases. It's hopefully a blip. We've seen that before, but we just have to watch. I am not aware of any surges in other strains or variations of the virus to suspect we're going to see another upward trend. But again, the downward trend is slower than the upward trend was. We did have a slight blip this week, about 20 cases per 100,000. But we'll just watch that. Again, the overall trend over the last month or plus has been slowly downward. That's why I say it's fragile. If people let their guard down, if we don't continue to make progress on vaccinations, people in public places aren't wearing their masks, we could definitely see another uptick. Are there any concerns Skagit County, other neighbors increasing case rates can spill over into Snohomish County?
Well, I would say that the virus doesn't respect boundaries. So it really has and always will be a responsibility for everyone to do their part, regardless of which county they live in, to make sure that we're all keeping each other safe. We have people that commute across county boundaries every single day, and every single one of those interactions is potentially an opportunity that there'll be a spread of infection. So it's really important that we all do our part, regardless of which county we live or work in.
So one other comment on the downward trend. I think we're, and I'm going to be cautious about predicting what the future holds for us, because we've seen 5 waves and some mini spikes even amongst those 5 waves. So I think we want to be cautiously optimistic, but not declare victory when we've seen this sort of happen before. I mean, our vaccination rate of 70% is great, but that means 30% of the population is not, and that's a pretty large, that's hundreds of thousands of people that have not been vaccinated yet. So there's still potential to see surges, and we'll just hope that it continues to go down. And this 5th wave was the last one, but only time will tell. Any other questions?
Do a last call for questions. All right, seeing none, we will go ahead and wrap up for today. Thank you for joining us today, and please stay tuned for future media availabilities. Have a great day.
Thank you.